If you are like me, every now and then, either you wake up and your neck is killing you, or it's at the end of the day and you're like, oh, my neck is so tired. My muscles in my upper back and shoulders are so tired. I wish somebody could just, I don't know, pull my head. That would make me feel great. Well, here in physical therapy, we have something just like that. And you may not know it, so I want to show it to you today. It's something that's one of the tools in our toolboxes as physical therapists. And, sometimes we forget that not everybody knows what we do. And this is one of the things that we do that feel good. So it's mechanical cervical traction. The benefits of cervical traction when you do it mechanically is that I can sit here and I can pull on your neck and make you feel good, but after a while my hands are going to start giving out because I'm a human. But if you use a machine, that machine can pull as long as you want it to. It will not let go. Now the downside of that is that if I were pulling your head, I could feel you releasing, tightening up, moving one way or another. In other words, I could use the feedback that your body is giving my hands and I can adjust it accordingly. With a machine, you can't do that. So there's some pluses and minuses to using mechanical traction, but what the heck does it look like? I'm going to show you right now. So when you come into physical therapy and you get cervical traction, you just come in and you sit on the table and you have this unit, which is the halter or the harness for it, and then a pillow. And I'm going to lie down, and my friend Taylor here is going to adjust it accordingly and turn it on, and you'll see how easy it is. Now, I tend to like to keep my knees bent, or you can keep it straight, whatever you want. And she's going to tighten up the headband around my head. And normally we would put a towel or something around you, but we don't need to because that's just me and it's the video, so you don't need all that. She's tightening up the bolsters that are behind my skull so that it's nice and tight, so it's kind of grabby. And she'll normally say, "Hey, does that feel good?" And I'm going to say, "Yep, feels good to me." And then from there, there's a button that I could always turn it off so that I'm in control. For those of you who have control issues, it's not you, of course. Ready? Yep. And then she's going to turn it on. Now, when she turns it on, it's going to start with 0 pounds of pull, and then she's going to slowly adjust it by increasing that poundage. And I'm just starting to feel a little bit of a pull now. And we can describe the pull as, and that's good like that, we can describe that pull as light, medium, or heavy. And we can do the pull in a static way or an intermittent pull, depending on what we want to accomplish. So that is mechanical cervical traction. Oh boy, that feels great. And if you ever need this, we're happy to do this for you.